without folks like BD Canada, without Susan and Safe Haven. And I want to, the person that does more work than I do, my minister, Jill Dunlop. Jill, do you have a minute? Jill leads the way at cabinet when it comes to supporting the communities, supporting organizations like Safe Haven, and I want to thank you for all the hard work you do. And Jill travels around the province making sure organizations like this are taken care of. And I always say this is where the money should be spent. I see a lot of waste in government. These are the organizations that, you know, I always say there's different types of organizations. They take $1 and turn it into $10. So we'll always have our support, Susan.
Thank you.
Thank you.
No, we appreciate all the work that you're doing, and we talked about the work you're doing with women's shelters as well too, and child welfare. So it's amazing. Thank you to the amazing nurses that we met today who are looking after, you know, some of our most vulnerable population in Ontario. And we're here to support them. And I'm glad the Premier came by to visit as well and meet with Patrick and Leo and the group here. So thank you so much for the incredible work that you're doing to support Ontario's most vulnerable population.
And the last request, these corporations, people, please make a donation to Safe Haven. It's the best money ever spent. If you ever have an opportunity, once we get through this pandemic, not now, but please come by for a tour. Rip your heart out seeing first the kids, but all the great work that they do here. So please make a donation to Safe Haven. Thank you.
There's questions whether we'll have enough of the rapid test, and could you foreshadow who else is going to? There's a lot of tests out there. Where else are the rapid tests?
Yeah, so we've deployed it. We've opened up the portal. Over 1,000 companies have applied. A lot of companies, we already have it into the field, and obviously long-term care is our priority. We're leading the whole country with second doses of the vaccines and long-term care, over 57%. I always want to remind everyone we're 38% of the population, 57% have been vaccinated, and again, with a rapid test, 67% of everything that's been deployed in this country comes from Ontario. And it's not the government, it's great folks, again, BD Canada, other organizations that are helping us out. So it's important that we get more rapid tests as soon as possible, because as we continue to ramp up, we're going through 1 million. I think that's for small. Also, the schools, we're doing the rapid tests in the schools as well. So I encourage every company out there, any organization, any government-run organization, please ask for the rapid tests. We'll get them out, and they're free. Well, yes, nothing's free, but the province and the feds are going to be paying for it. So please ask for the rapid tests.
Yesterday during Dr. Duck's press conference, John McGrath from TVO asked about the third wave. Is it inevitable? And if we shouldn't continue the lockdown, if it is inevitable?
Well, I'll tell you, right now, when we're opening up cautiously, it's not a wide open, rah, let's go party. There's a lot of areas, Toronto, still in lockdown, gray. Peel, still in lockdown in gray. York, still in lockdown in gray. And folks, please stay home. Please don't be traveling. Please do not have people over to the house. By no means is this wide open. We have to be cautious, super cautious. We saw what happened before, and we don't want it to happen again. So we're doing a little bit of a balance and letting small businesses open up very cautiously. But again, I stress, follow the guidelines and the protocols. No matter what the hospitals do, no matter what the government does, it's really up to the great people of Ontario that have done a great job so far. We've seen the numbers come down, but we're always concerned about the UK variant, South African variant, Brazilian variant. It moves a lot quicker, so we have to be super cautious again. Very concerned all the time.
So by the lack of the answer yesterday and today, it looks like we're going to have a third wave.
Well, again, I've always followed the health advice from our doctors 100% of the time. When they tell me something, I follow the doc's instructions per se. And it's up to us to avoid that third wave. It can be done if we follow the protocols, if we stay at home as much as possible outside of going out and getting essential groceries and maybe medical appointments. Stay at home. I can't stress it enough. And we can avoid it. We've seen that. We thought the numbers were going to go up before. Everyone pitched in. All Ontarians pitched in, and the numbers are coming down only because of the work that each and every one of you have done. So let's continue being vigilant, and we will get through this. We have to create a bridge until we get mass vaccinations throughout Ontario, which will happen in April, May, and June.
And what are they updating vaccine numbers? Are we going to get them? There's some rumors of
Well, I know the federal government's working extremely hard. They really are. We were expecting 90,000 Moderna doses. We're only getting 47,000 next week. So it's concerning. But we're maximizing those dosages to make sure we take care of the most vulnerable people. Again, out of all the second doses in Canada, Ontario leads the way once again with 57% of the second doses and 67% of the rapid test. So if we continue increasing rapid test, increasing the second doses, most vulnerable communities, we still have to be vigilant, but we'll be a lot further ahead than a lot of people around the world.
Perfect. Thank you, Mr. Premier.
That's great. Thank you.
How about this test? What's happening now?